If you've had trouble getting in to see your primary care provider, you're not alone. An analysis from the National Center for Health Workforce projects a shortage of more than 87,000 primary care physicians by 2037, meaning longer wait times and shorter visits. Recently, I talked with Zeev Neuwirth, a physician, healthcare executive, and host of the podcast Creating a New Healthcare, about what the future holds for primary care and the patients who depend on it. Why can I never get in to see my primary care physician? Why does it take so long to get an appointment? When I am there, why am I not there as long as I feel like I should be? Why don't they have a lot of time to spend with me? What's going on in healthcare? What are some of the challenges that primary care is facing?
You can't point your fingers at the primary care doctors themselves. Having myself practice primary care for many, many years, and my friends and colleagues who are primary care doctors, even in their day-to-day work, when you look at how much support they have around them, if they're lucky, they'll have a medical assistant or a nurse. If they're lucky, you look at most specialists and they'll have 2, 3, 4, sometimes more people around them supporting them, really helping them, allowing them to do, and it's the right thing, to do the thing they were trained. Whereas primary care doctors are spending, easily 2, 3, 4 hours a day doing essentially data entry and data retrieval.
Given that it could be months to actually get in, if you're talking about a checkup, you just know, right? You have your annual physical, you make the appointment months before you need it, and you're okay. But if you're talking about an acute illness or even a chronic illness where you need to see your physician for things, how do you see the role of primary care changing and how we use our primary care physicians?
We're going to have to do what third world countries do, which is basically deputize people who are not clinicians to go and do healthcare. So there are, community health worker types in other countries that get trained and they go literally on mopeds into rural areas, into people's homes, and they do checkups and visits, and they could do things like, stress tests and basic stuff that they can be trained to do. I mean, if I, as a primary care physician, was sitting here sort of like in a control room, right? If this was a control room and I had at my disposal hundreds of community health workers, I could direct them to take care of a whole community.
For more from Zeev Neuwirth, you can look for our full conversation on an upcoming Hi-Fi Health News podcast. Thanks for watching.